Hello everyone.
Yeah, I'm audible, right?
Yes, sir.
Sir,
Yeah. Thank you for everyone. Okay, today also we can continue the remaining queries. Okay, we can cover that. And once I complete the queries all, I will share the record dates and all the material at a time. Okay, don't worry. I will share everything with you, but do not worry, hurry. Clear? Give me some time. I will share all the materials with you. Clear?
Yes, sir.
Thank you. So, are you able to see my screen?
Yes, sir.
Yes, sir.
Up to yesterday, we discussed clinical indicator query last concept, correct? See, guys, first thing, who already know these queries and all, just you can listen. Okay, I know if you know, do not worry about that. Okay, just listen. At least who are don't know, they will get idea. If you are disturbing me simply now, they will get irritating. So who already know the queries, everything, just listen. Okay, if you get any new point, you can note down. That's it. If you have any doubt, you can ask me. I will explain. So, up to clinical indicators we discussed. So, what is the meaning of clinical indicators? What is the meaning of clinical indicators?
signs and symptoms.
Sign and symptoms. Then, not only diagnostic and
Diagnostic and therapeutic options of particular condition.
medication, diagnostic studies like labs, X-rays, everything comes under clinical indicators. Okay, so if they performed minimum 3 indicators, they documented minimum 3 indicators, but they not documented condition. At that time, we need to raise the query based on the indicators for the particular condition. So, how we need to raise the query and all? We can discuss related to clinical indicators. Okay. So, they given the clinical indicators. Okay. Like 3 indicators they given, suppose. These are the indicators supporting for
CHF.
CHF, correct? Chest X-ray, chest X-ray, SOB, BNP. They performed. Suppose they documented. Based on these indicators, we need to raise the query for
CHF.
CHF. Now, based on the indicators or clinical evidence, you are unable to find for which indicators, which condition that indicators are supporting, are the clinical evidence supported for multiple conditions. At that time, they given altered mental status, fever, like this multiple indicators they given. At that time, how we need to raise the query? based on the indicators. For which condition we don't know, no? At that time, how we need to raise the query? Simple. Based on the all clinical evidence, we need to provide to the physician and we need to ask the provider. So these are the indicators we have. So please provide the diagnosis if you know. Because we are unable to lead the particular diagnosis based on the indicators, what we need to do? We need to ask the provider. So please provide the valid diagnosis based on the indicators. Okay. So based on this concept, we have two types of queries. Here don't confuse, listen carefully. Leading or non-compliant. Same meaning. Compliant or non-leading. How we need to raise these queries depends on the indicators. Remember, if based on the indicators, if you know the diagnosis, if you mention the diagnosis to provider, like patient have SOB, chest X-ray, and BNP. So these are the indicators supported for CHF. No? So are you treating CHF? We can ask directly. But same indicators, how we need to raise the query for complaint version or non-leading version? Same. Patient have same indicator. Suppose we don't know this indicator supported for which diagnosis, for example. How we need to raise? No, patient have so and so. Patient have listed indicators. Please provide valid diagnosis. Valid diagnosis related to the indicators. It should be compliant version, non-leading. Same. So leading means, what is the meaning of leading? You are directly lead to the particular condition. There is no complaint. Okay, there is no complaint. You are directly leading to the particular condition. It should be leading or non-complaint. You are unable to lead based on the indicators. We are unable to find exact diagnosis for which diagnosis this indicator supporting non-leading, and we are complaining about condition to provider. It should be compliant or non-leading queries. Clear? In simple form, they given indicators, and if they mention diagnosis also along with indicators, it should be leading. If they mentioned only indicators and them asked to provide the diagnosis, it should be non-leading or complaint. So I will show the examples. Please find that should be complaint version or non-complaint version. Each example. The option A is complaint version or non-complaint version.
Leading.
Leading, correct?
Leading, sir.
Leading, which means non-complaint, correct? Leading, another name should be non-complaint, no? Leading or non-complaint, complaint or non-leading, same meaning. Okay, if they asked, so tell me the which of the example is complaint query, which means we need to find. Which of the example is non-complaint, we need to find. Leading, non-complaint, non-leading, complaint, same meaning. So here option A should be leading, non-complaint. Option B, here see, They given all the indicators, but they not mention the diagnosis. Correct? This indicators was not meeting for the particular diagnosis. Correct? They are saying respiratory rate, temperature, heart rate, hypotension, alternate mental status, and IV antibiotic administration, and IV fluid resuscitation. So we don't know for which condition they are doing these indicators.
The
At that time,
pneumonia diagnosis.
already they admitted with pneumonia. This is the diagnosis. But these indicators, why the patient get altered mental status for pneumonia? Why hypotension? Why heart rate for pneumonia? Correct? So we don't know these are the indicators for which diagnosis. At that time, what we need to do? We need to ask the patient. So please provide the diagnosis. It should be complaint version. Then option C,
Leading, sir, non-complaint.
Leading.
non-complaint version, correct? Then option D,
Complaint, non-leading.
was leading, no? They are asking directly, please document the condition of severe sepsis. Based on the indicators, they are asking the sepsis related. Then it should be non-complaint, leading, right? All the indicators they are asking sepsis. It should be non-complaint version. No? See here, you need to check the example. It should be valid for the complaint version of format or non-complaint version of format. Okay. So based on the indicators, if you mention the diagnosis, it should be non-complaint, leading. If unable to mention the diagnosis, you ask the provider to mention the diagnosis, it should be complaint, non-leading. Say, I give an example right now. Same format, how we need to raise the complaint version and non-complaint version for the same indicators. Suppose patient has SOB, chest X-ray, BNP. If you are asking, are you treating CHF, it should be leading, non-complaint. If patient have same diagnosis, SOB, chest X-ray, BNP, patient have listed or indicates, please provide the valid diagnosis. If we mention that providing diagnosis, it should be complaint version. Clear?
Yes, sir.
Yes.
Next. So guys, up to now we discussed the queries, right? Now, how we need to raise the query to provider? We need certain format, right? While we are raising a query, we need certain format, no? We need to follow the certain procedure, right? We should not write like anything, no? We need to follow a format to raise the query. So based on the rise of query format, we have total 3 types of queries. In these 3 types, any one format we need to use while raising the query. That format should be yes or no query type. From here you can listen carefully. Yes or no query type. Multiple choice query type. Open-ended. Open-ended query type. In these 3 formats, any one format we need to use based on the situation. Okay, based on the query issue. So any one format we need to use in these 3. So yes or no format or multiple choice query format or open-ended query format. Any one format we need to use to raise the query. So first thing, yes or no query format. Yes or no means question type. Question type, okay? Within 2 options, you will provide only 2 options to the physician. 2 options only. Within two options, we need to get the answer. Okay. Within two options, you will give. So please tell me, does patient have or not? Yes, no. Suppose a pathologist documented adenocarcinoma. Just we need to confirm that adenocarcinoma patient have or not. That's it, right? That's why you need to give just two options. A patient have adenocarcinoma. Please tell me it was yes, no. Yes means patient have the diagnosis. No means not. That's it. Clear? Just we need to check two options. It should be yes or no query. Next. Suppose multiple choice query type. They will give unlimited options. Unlimited option. Okay. Unlimited options. There is no limit. You need to provide all the options to the provider while raising the query. So open-ended means free text format. We need to write our concern. Free text format should be open-ended. In these three formats, we need to use while we are raising the query. Yes or no query type, multiple choice type, or open-ended query type. So now I will show example how you will get the document at the time of yes or no query and all. See, this is the open-ended query. Okay. For example of open-ended query, how we need to raise. See, in the leading format, how we need to ask. This is the leading format. Same query patient have. In the leading format, how we need to ask. The patient have elevated WBC, tachycardia, IV antibiotic, pseudomonas culture from blood. Are you treating sepsis? In the non-leading format, how we need to ask. Same open-ended query. These are the free text. How we need to ask in the non-leading format. You need to provide all the indicators and please document the condition and the causative organism if known. It should be non-leading format. For same query, we can ask either leading format or non-leading format, depends. So open-ended query means your query concern should be free text. Next, multiple choice query. So this is the question, like patient admitted with right hip fracture. The HNP notes that patient has history of chronic congestive heart failure. A recent echocardiogram shows left ventricular ejection fraction 25%. The patient was on home medication, leading. Okay, leading means how we need to ask. For every question they given. Like please document if you agree with the chronic diastolic heart failure. If they mention. If non-leading, you don't know for which heart failure. Now, how we need to ask? You need to mention all the clinical options, okay? All we need to provide. Like chronic systolic or chronic diastolic, chronic systolic and diastolic, some other type or undetermined type. If you give the multiple options to provider to specify the diagnosis, it should be multiple choice query. Okay, if you give multiple options, there is no limit for the options. Then yes or no query, simple. Two options, yes, no, other or undetermined. These two options common for any query format, other and undetermined. So yes, no. In these two options, we need to resolve the diagnosis. Yes, no. See here, the documented patient is admitted with cellulitis around recent operative wound site, and only cellulitis documented without any relationship to the recent surgical procedure. Just we need to ask if the cellulitis is due to the surgical procedure or not. That's it. If they said yes, it was related to cellular surgical procedure, they will tick to yes. If it was unrelated, no. If any other, they will write other. That's it. In as no other, in this format, If we get the option, it should be yes or no type. If we get like this format, multiple choice, no options, just free text, it should be which type of query?
Open-ended.
Open-ended. Clear? So yes, no other, yes or no type, open-ended type, multiple choice format type. Now you get the idea about query formats, right? How we need to raise the query. Yes or no query, how we need to give the options like this. You need to raise your concern and options like this. Multiple choice like this. Free text, simple, we need to type our concern. Yeah. Multiple choice means we need to provide unlimited options. All the suitable options we need to provide to the provider while you are raising a query. Suppose they documented CHF in the record. We don't know which type of CHF. At that time, we need to document all the types of CHF and we need to give the provider. Please specify which type of CHF you are treating. It should be multiple choice query. Clear?
Hello, sir.
Yeah.
So we can choose any one type of query type to ask the question, right? It is
That's
not
it. In this
mandatory
part,
for
not
such.
mandatory. Anyone which
Oh.
for query format suitable, we need to go with that. Okay.
Oh.
If you are asking, yeah, I will tell for which type of query, what format we need to use. Okay.
Yeah.
You can understand the query formats. Now, for yes or no query, when we need to raise multiple choice and all we can discuss. Any one format only we need to use in these three while you are raising a query. Depends on the situation. Clear? Now, first, when we need to use the yes or no query type, tell me in which type you will use, which type of query we can get the resolve in two options. Cause and effective related queries. While we are raising cause and effective relation query, we need to provide just two options. That condition was related or unrelated. We need, that's it. Then pathology queries, like conflict between the true providers. Then POA indicator queries. I completed POA, right, for you?
Yes.
So while you are adding U indicator, we need to raise the POA indicator query. So please provide the valid present on admission status YRN. Clear? So for multiple choice type, RQT. Okay. So here open-ended, like clinical evidence related. Like clinical indicator related types. Okay, or clinical validation related. We need to raise in the free text format. Clinical evidence or clinical indicator related. It should be open-ended type. Clear?
Sir, laterality one, which one?
Laterality also will get in this cause yes or no type only, no? Just we need the type. So laterality also yes or no type. Just you will get a answer in two options, right? You need just right or left. You will give yes or no, which type. That's it, no? Correct? Any doubt?
No, sir.
This format's clear, right? Yes or no, multiple choice, open-ended, compliant, and non-compliant formats. These are the main topics in the queries. Okay. So yes or no format, how we need to raise, how you will get the template, multiple choice, how you will get the template, open-ended, how you will get the template. Okay. Then when we need to raise, how we need to raise the leading version, how we need to raise the query for non-leading version. Okay. Leading version means you will mention the diagnosis. Non-leading, we need to ask the provider for diagnosis. Simple. If you should not mention the diagnosis in the indicate along with indicators, it should be non-leading or complaint, same meaning. Leading or non-complaint query also same meaning. Okay. Now,
Yes, sir. Leading query, I think we should not query in IP record like that. I heard.
I
Is
don't
that
get
correct?
leading query
Leading query we should not raise
in
like
your
that. I
project.
heard in IP.
Not like that. Depends on your projects and all. Okay.
Okay.
Nobody says we should not raise the leading query. You can
Okay.
raise depends on your project. Some people will follow the different guidelines in the queries also. Okay. In your project specific, you can follow. For exam, you can follow general concepts. Okay. Clear? Huh?
Yes.
These are general query guidelines, not project specific. Okay, now based on the project, you will get similar changes in each project. Okay, and their own guidelines they will give sometimes. Now we can practice the examples. This is the main part. If you understand the examples, then you will get easily answers. So first question, tell me the answer.
D.
D.
No specific.
D. So while we are raising a multiple choice, so there is no limit. Okay, there is no specific number like this. Okay, we need to provide any options like 4 or 5 or 3. Okay, there is no specific number. You need to give unlimited options. Depends on the query opportunity. Next, who already know the queries, just listen. Okay, if you answer no, at least who are don't know, they can't try. Who already know all the queries and all, just you can watch it. Next, complaint queries includes which of the following? While we are raising a complaint version of query, what we need to find in the record? So who already know IPDRG, just watch. Who don't know, you people can try. What are the things we need while you are raising a complaint query?
Relevant clinical indicators.
Option B.
Option B, relevant clinical indicators, correct? Relevant clinical indicators compulsory. They need to document relevant clinical indicators while we are raising a query. So these are all you see now in the complaint version. Complaint means non-leading. No, we need to mention all the indicators. Okay, for which in conditions they are supporting. All indicators we need to mention. We need relevant clinical indicators while we are raising a query for the complaint version. Next, tell me. This format is a complaint query. Why or why not? Read carefully and answer. Okay. Who already know the coding and these queries and all, just watch it. Done. It should be complaint format or not?
Yes.
It is.
Yes.
So which option correct here?
A option.
Option A.
D.
What format this one?
It is D.
Open-ended, right?
Is free text format. Open-ended query.
Open-ended
Yes,
query. So this is the
yes.
permissible of open-ended. Correct. Open-ended query. This is the yes. It was a complaint query. Yes, it was a complaint query. We have two options. It was without leading the provider response, or we need open-ended query permissible. We need to raise in open-ended format. Okay, these are the open-ended format query. So now only we discuss now. So in the complaint version, open-ended like free text, all we need to type. So open-ended process it was. Clear? Yes, open-ended query is permissible. Clear? Any doubt? Hello. Guys, if you have any doubt, you can ask me. If you don't know, well,
No, sir. Clear, sir.
thank you. So understand the queries because we'll get 30 to 40 marks easily. That's all. Next, examine the following query and determine if it is a complaint and why Dr. Reynolds is possible that the patient has acute post-operative blood loss anemia based on the drop in hemoglobin and hematocrit that occurred after surgery as noted in the lab report. Yes or no? What type of query we need to raise here? It was a complaint or not? They asking. It was a complaint version or non-complaint version?
Non-complaint version.
So yes or no?
Yes.
So option E, yes or no? It was a they asking examine the following query and determine if it is complaint and why. If it was complaint means you will get yes. If it was not complaint means you will get no. So yes or no? It was complaint version or not?
Option
It
C,
was
sir.
not.
Eh,
It was not a complaint version, right? They documented the diagnosis clearly. No? So no, it was not a complaint version. Now tell me, C or D? C.
C, sir.
C. Okay, C. No, because the query is leading. Okay, it was directly leading to anemia, but inappropriately they include the term possible in the question. That's it. They documented simply possible, but confirmly all the indicators supported for anemia here. Okay, they documented already acute blood loss anemia based on the indicators. Like hemoglobin low and hematocrit are the indicators, and they documented the diagnosis acute blood loss anemia. So if they documented the condition, it should be complaint version or non-complaint version. while we are raising a query, along with indicators, if they mention the diagnosis, it should be a compliant version or non-compliant version.
Non-compliant version lead.
Non-compliant version, right? Leading. Correct?
Yes, sir.
So here they're asking it was a complaint query or not. It was not a complaint query, no? So no, it was not a
Yes.
complaint query, non-complaint query. Option C. Now identify the diagnosis based on the clinical indicators. Here they given the multiple clinical indicators and they asking for which condition you will raise the query.
PHF, sir. B.
CHF.
Correct.
CHF.
B.
Correct. CHF, right? See here, the documented like ejection fraction, Lasix. Lasix for which medication we need to use in this list?
CHF. CHF treatment, sir.
CHF. Congestive heart failure. So based on the indicators, for which condition it was supported na CHF. Suppose you will get the question like this. If they given three indicators and they will ask these indicators supported for which diagnosis. Okay, which diagnosis these indicators supported. So we need to get the idea that indicates related to which condition. Clear? So here answer should be CHF. Next, which of the following make a complaint query? What is the example of complaint query in this list? What when we need to make a complaint query? Option
D.
D.
Provider.
B.
Mhm.
D.
They need clinical indicators, right? While we are raising a make a complaint, we need the clinical indicators. Based on the clinical indicators only, we can make the complaint query. Correct? Like this,
Yes,
if you
sir.
know the indicators, based on the indicators, you will give the indicators and you will ask the complaint format. Like here, they given options like higher reimbursement, no. Then keeping the question wage patient as an opportunity to use the description when responding. No, addressing the impact of query has on quality indicators, not quality indicators. It was a clinical indicators. Clear?
Okay, sir.
Option D correct. Remember, when we are raising a complaint query, we need clinical indicators compulsory. Next, seventh question. So this is a valid query. Why or why not? So they raise the query format. It is a valid format or not?
Yes, sir. Valid format.
See how they raise the query here. Check. Read the question and they raise the query in which format. This is the correct format for this question or not? here patient was admitted for replacement of the left hip. Okay, they are coming for the hip procedure due to degenerative osteoarthritis. In the operative report, the surgeon noted that last 200 ml of blood during the procedure, necessitating transfusion post-surgery. The provider did not mention the blood loss in the discharge summary. Okay, so the coding professional create this query: acute blood loss anemia. Acute blood loss anemia. Dr. White, you noted in your operative note blood loss during the surgery and the need for a transfusion after the procedure. The patient did receive 2 units of plaque cells. Can you identify the diagnosis? What was treated? So, this is which format of query? It was yes or no format or complaint format or non-complaint format? Or open-ended format also?
Open-ended.
Open-ended.
Open-ended. Okay.
Open-ended.
In the options we have open-ended. We have option in open-ended.
No,
Now,
sir.
Yes, sir.
it was leading
Yes, sir.
or
No
non-leading?
Yes, sir. No query, sir.
Yes, sir. No option.
How it will be yes or no?
MCQ query.
So it was directly leading, right?
Leading non-complaint.
It was a leading query, no? So if they mention the diagnosis in the documentation, they mention the acute blood loss anemia, so it should be leading. The title of the query is leading, not yes or no query. Okay, this is the yes or no format. It is the not correct format. Okay, we should not raise the query like this. Already, if you mention the acute blood loss anemia, why again we need to document post-operative anemia, other anemia in the query opportunity? You are raising the query directly for the acute blood loss anemia. Correct? Huh? You are created a query based on the indicators acute blood loss anemia directly you mentioned. Then again, why we need to give the options like this? If you are giving the options like this, we should not mention the diagnosis from the query content. Correct? Just you need to give the clinical indicators to the provider, and if you mention, ask the condition, then it should be non-leading format you need to ask if you don't know the diagnosis based on the indicators. In the open-ended text, we need to ask the leading or non-leading version. Here they mention the diagnosis. It should be leading version, correct?
Leading. Yes, sir.
Yes, so it was a leading. The title was wrong. It was not a yes or no format. We should not ask yes or no like this. We should not mention the diagnosis in the yes or no format. Okay. While the conflict in the document, like cause and effective relation, conflict, or pathology documented diagnosis, for that we need to raise the yes or no type. Suppose they documented 2 diagnoses, but they're not interlinking between 2. Then we need to raise the query yes or no. The diagnosis was related to the above condition or not. That is the yes or no. If they're not documented POA properly, then you need to raise the yes or no format. This is not a yes or no, it was open-ended leading type. Okay, it should be leading type of query. Option A. Clear?
So can you explain this once again?
Listen. So they raise the query template, patient acute blood loss anemia, are you treating or not? They given directly based on the indicators acute blood loss anemia they mentioned. Okay, coding professional created this query for acute blood loss anemia. They documented the diagnosis based on the indicators that was 100 ml of blood loss and the transfusion after the procedure. And patient did receive the 2 units of packed cells. Can you identify the diagnosis for what was treated? So based on the indicators, coder identified these are the related indicators to acute blood loss anemia and they mention the diagnosis to the provider. Okay. Relevant indicators supported for acute blood loss anemia, coder thought. And they mention the diagnosis for provider also, only acute blood loss anemia. They are not given any other option while raising the query. Simply they given, are you treating acute blood loss anemia or not, like that. So it should be leading version or non-leading version. Based on the indicators, if you mention the condition, it should be leading version or non-leading version.
Leading version.
Leading
See,
version.
that's right. So the title of the query is leading. But here, this type of query format should be not leading version. It should be non-leading version, right?
Yes.
Multiple options they given, na? So 1 minute. Same multiple choice. How we need to lead leading version? Like this. Correct? Please document if you agree the condition. So here also they documented the diagnosis, right? Yes or no? Yes. Same.
Yes, sir.
Based on the indicators, if you raise the query like this, if you give the options again, it should be non-leading version. Here also they given